Hi, I'm Dr. Judy. Tick season is in full swing in my area, so today we're going to talk about Lyme's disease. In the United States, Lyme's disease is the most common tick-transmitted disease in humans and dogs. It occurs mostly in the northeastern states, the Atlantic states, the Midwest states, and the extreme West Coast area. Lyme's disease is caused by the spirochete bacteria Borrelia burgdorferi, and is transmitted by ticks, Ixodes scapularis, most commonly called the black-legged deer tick. Lyme's disease can affect horses, cattle, dogs, cats, and humans. How does your pet get infected with Lyme's disease? Ticks infected with Lyme disease attach and feed on a host such as your dog. The Lyme bacteria stimulated by the blood meal migrates to the salivary glands of the tick and is transferred to your dog. Note, ticks need to feed at least 36 to 48 hours to transfer this infection to the new host. What are the symptoms of Lyme disease? Dogs and humans actually share several symptoms in this disease. Humans may observe a skin rash around the site of the tick bite, but both humans and dogs develop fever, fatigue, decreased activity, decreased appetite, muscle and joint pain. 2 to 5 months later, more severe muscle and joint pain reoccurs. Possibly neurological symptoms such as tremors may also be observed. What is the treatment for Lyme's disease? Antibiotics such as tetracyclines and amoxicillin administered for 4 weeks give good relief of symptoms, but antibiotics usually fail to totally eliminate this infection. Lyme disease is often a lifelong, reoccurring health problem. How can Lyme's disease be avoided? Tick control, very important. First, check your pet for ticks. Next, apply monthly a flea and tick prevention medication that will keep the ticks off your pet. A vaccination program will prevent transmission of Lyme's disease to your pet. Before vaccination, your veterinarian will administer a Lyme screening test. This is called a SNAP test. In an area where Lyme's disease occurs, 10 to 60% of unvaccinated dogs may test positive. We also know that 90% of infected dogs may not show symptoms, but if the Lyme's test is positive, treatment is always recommended. If negative, discuss vaccination procedures with your veterinarian. Lyme's disease is on the rise throughout the United States, but it can be stopped with preventive measures. Keep an eye out for those ticks. Remember, pets are family too.
Down the Road is brought to you in part by Prince Agra, makers of Omnigen AF, advancing animal nutrition for healthy animals, and Woodruff Enterprise of Springfield, Ohio.